Today, the presentations are focused around two of the four scientific themes I mentioned yesterday. And today's focus is going to be on frontiers in dementia diagnosis, treatment, and prevention. And then this afternoon session will be focused on some very exciting new discoveries in the field of regenerative medicine as it relates to dementia and aging. So we have two institutional leaders who are going to address us and share with us some of the plans at the institutional level that the university and the Department of Medicine has for this area of research. So it's truly a pleasure and an honor to introduce and invite Dr. Jan Greenberg, who is the Associate Vice Chancellor for Graduate Studies and Research, and he's in the Social Science Division of that office. Dr. Greenberg received his PhD in Family Social Service from University of Minnesota, and prior to that, he had received his master's in social work from University of Wisconsin. He is truly internationally renowned, and his research is on a very important area of research, of investigation directly relevant to today's focus, which is families and persons with mental illness and how aging parents, when they work as caregiver, what is the impact on these parents and when they care for children with mental illnesses. This is such an important topic where a lot more needs to be learned. Dr. Greenberg was also director of the School of Social Work here at UW for many, many years. And he is, he has many honors and awards, as you can imagine, but in October 2014, he was inducted into the American Academy of Social Work and Social Welfare, and is also a recipient of the Distinguished Alumni Award from University of Minnesota. Needless to say, he has multiple very important published papers over decades, and he has had substantial NIH and other funding to support his research ever since he came to UW-Madison. It's truly an honor to invite Chancellor Greenberg to make his comments.
Thank you, Sanjay, for those kind words. Masha Malik, the Vice Chancellor for Research and Graduate Education, sends her regrets for not being able to be here today. She was looking forward to it, but because of a scheduling conflict, she couldn't make it. We very much appreciate the opportunity to talk about how our office is supporting interdisciplinary research on Alzheimer's disease on campus. I went over your schedule today. You have ahead of you a number of really inspiring talks. I'll try to keep my remarks brief. Alzheimer's disease and other dementias today cost the country $226 billion per year. With the aging of our population, it's estimated that the price tag is going to rise to $1.1 billion by 2050. The state of Wisconsin will experience a dramatic growth in the number of persons with Alzheimer's disease over the next 30 years. Currently, nearly 115,000 residents have Alzheimer's disease, and it's estimated by 2040, 242,000 will have dementia. During this same period of time, there's going to be a dramatic change in the composition of the population in Wisconsin. Both the Hispanic population will double in size by 2040, and it's expected that the African American community will also double. Both of these populations are increased risk for Alzheimer's disease and other dementias compared to Caucasians. I think these data speak to the oncoming of a social and economic epidemic of dementia, underlying the desperate need for effective therapies that can slow or halt disease progression or improve its management. In response, The UW-Madison has identified aging and dementia research in the search for new treatments and prevention strategies for Alzheimer's disease as among its very top priorities. The UW-Madison has a long tradition of interdisciplinary research centers that bring together faculty from across the campus. Our office administers 17 such centers, including the Institute on Aging. To support collaborative research across the campus, our office launched what we call the UW 2020 Worth Discovery Initiative last year. And several of the UW 2020 funded projects support interdisciplinary research on Alzheimer's disease, and many of these involve investigators of the ADRC. One UW 2020 project is led by Sterling Johnson to better understand the metabolic pathways in Alzheimer's disease. This project uses precision mass spectrometry to analyze blood and plasma samples for metabolites relevant to Alzheimer's disease. Another project that was just recently funded is developing a therapy for Alzheimer's disease by using novel genome editing CRISPR-based tools that were developed here at the UW-Madison. This project will use CRISPR-Cas9 technology to cut and slice pathological proteins to Alzheimer's disease. It brings together collaborations from pathology, neuroscience, biomedical engineering, and the Weissman Center. As a social scientist, I wanted to stress that the UW-Madison is uniquely positioned to develop interdisciplinary collaborations between social scientists and medical researchers in the study of Alzheimer's disease and other dementias, as we are the home of two of the largest and longest standing longitudinal surveys in the field of aging. One is known as the Wisconsin Longitudinal Study, known as the WLS, and the other is known as the Midlife United States Study, also known as MIDAS. The WLS has followed a cohort of Wisconsin citizens since 1957, when they were either juniors or seniors in high school, and now they're in their early 70s. A newly funded UW 2020 project titled Human Microbiome in Health and Diseases, led by Professor Roy in pathology, is analyzing data from the WLS to identify metabolites that serve as biomarkers for aging diseases, including Alzheimer's disease. This project involves scientific collaborations among 15 investigators on the campus that cut across 5 colleges and schools. The UW 2020 initiative also supports the purchase of major scientific equipment that's needed for groundbreaking research. In the past year, we've invested over $6 million for the purchase of research equipment to ensure that the UW-Madison remains a leader in scientific discovery. The UW, as part of one of the UW projects, UW 2020 projects, is supporting the development of a human exercise core facility. This represents a collaboration between the School of Nursing and the School of Education. This core facility will provide state-of-the-art technology for ADRC investigators engaged in studies of the relationship of aerobic exercise to Alzheimer's disease. In the spirit of the Wisconsin idea, a great strength of the ADRC on this campus is its reach beyond the boundaries of the university to the boundaries of the state and the nation. The ADRC's efforts have been truly extraordinary in reaching out to the community, in particular to engaging communities of color in Alzheimer's research. The strength of this partnership with the community will help ensure that breakthroughs that occur through the ADRC will move quickly from the lab to the community to improve the standard of care for individuals with Alzheimer's disease and other dementias in Wisconsin across the world. In a few short years, under Sanjay's leadership, the UW-Madison has become a world-class center for the study of Alzheimer's disease. It's known for its highly innovative, groundbreaking, cutting-edge research. Under Sanjay's leadership, the ADRC has been able to bring together some of the most talented Alzheimer's researchers in the world who are committed to working collaboratively to new discoveries to improve the treatment and management of Alzheimer's disease and other dementias. The Office of the Vice Chancellor for Research and Graduate Education applauds these efforts and is committed, our office is committed to providing the necessary support to ensure that the UW-Madison remains at the cutting edge of Alzheimer's research. Thank you very much, and I hope you have a great day.